I've said this many times. I'll state it again because I don't want YouTube to take down this video. I am not anti-vaccine, okay? I've said this many times. I've written about it. I'm not against the vaccine. I've not gotten it. I have natural immunity. I think some people who are in high-risk categories should consider getting one of the ethically made vaccines. But what I'm against is people being forced by the government. A government mandate is absolutely the wrong way to go about this. Whether or not you decide the COVID vaccine is the right choice for you and your medical condition is a decision that you and your doctor should make, not something Joe Biden should make for you or OSHA, who will be the enforcement mechanism for his mandate. Joining me to talk more about this, Dr. Jeff Barrows, Senior Vice President of Bioethics and Public Policy for the Christian Medical and Dental Association. Dr. Barrows, welcome back to the program.
Hi, Tony. Great to be with you again.
I was looking back, and it was almost exactly a year ago that you and I were talking about this, and you warned about the mandate, those pursuing a utilitarian approach to this, an ends justifies the means, and here we are.
Yeah, in spite of the fact that several months ago, President Biden promised that he would not use a vaccine mandate, he has, as he often does, changed his mind and his approach. And so, yes, you're right. Since just a week ago, we are now facing a federal mandate to get the COVID-19 vaccine.
I want to play a clip of Dr. Fauci, because also in that interview a year ago, we talked about natural immunity. Play the clip of Dr. Fauci, please.
I get calls all the time. People say, I've already had COVID, I'm protected, and now the study says maybe even more protected than the vaccine alone. Should they also get the vaccine? How do you make the case to them?
You know, that's a really good point, Sanjay. I don't have a really firm answer for you on that. That's something that we're going to have to discuss regarding the durability of the response. The one thing the paper from Israel didn't tell you is whether or not, as high as the protection is with natural infection, what's the durability compared to the durability of a vaccine. So it is conceivable that you got infected, you're protected, but you may not be protected for an indefinite period of time. So I think that is something that we need to sit down and discuss seriously, because you very appropriately pointed out it is an issue, and there could be an argument for saying what you said.
I mean, we're a year and a half into this. I mean, and we haven't sat down to have that conversation. I would call that malpractice.
I agree. I'm very surprised that the CDC has not been gathering data on natural immunity, and specifically what would constitute a good level of natural immunity, which you could measure through titers of antibodies in the blood. And I think this is a mistake that this hasn't been done. I think that there are a lot of people out there that have had the infection, and I do want to make it clear that just because you may have had a very mild COVID-19 infection, that doesn't mean you have the level of immunity that might be generated by a vaccine. But I would say the vast majority of people, especially those that endured hospitalization, became very sick, were symptomatic for a long period of time, those individuals likely have the same level of immunity through natural means that they would get through a vaccination.
Dr. Barrows, I would think if all of the facts were put on the table and we were having an adult level conversation, like you just said, if you had a mild case, you may not have the natural immunity, so you really need to take that into consideration. But there's no discussion of that by the federal government. There's just this strong arm, one size fits all. You're going to get the vaccine, or if we have the power, we're going to fire you.
That is one of the problems with this federal mandate. That not taking into account the natural immunity, treating everyone as the same in terms of their level of risk from the infection, treating them the same as if they have the same level of exposure. And that's the reason that I personally believe that this widely and too broad vaccine mandate is unethical.
How are doctors, those in the medical profession, how are they going to respond to this?
Well, I think, number one, it will be helpful that they are not the ones pushing the mandate. I think it does take some pressure off of them, though I do worry that there'll be a certain group of patients that will come into the office that are absolutely opposed to the vaccine, and they will begin demanding from their healthcare professional that they grant them a medical exemption, that they say that they have some type of a disease that maybe they don't have, or that they are immunocompromised. And so I think this would put the physician, the healthcare professional, into an awkward position where they have to say no to the patient where they are in good health. There really is no medical reason that they can give for an exemption. And I'm concerned about that, and I think that's unfortunate.
Dr. Barrows, I'm also concerned about many in the medical community that are finding themselves under this mandate as well. They have to make the choice as to whether or not they'll have the vaccine or potentially lose their positions.
Yes, we've got several of our members that are adamantly opposed to the vaccine for a number of reasons, ethical, medical, lack of long-term studies, as well as the fact that many of them have had the infection itself. On the other hand, we have other healthcare professionals, frankly, that are very frustrated. Those that are working in emergency rooms, those that are working in manning intensive care units and taking care of the patients that become very ill. Frankly, we're hearing from them that they are frustrated that there are so many people that are still unvaccinated. So among our membership, we have both sides of the coin.
Well, I think we would be a lot further along had the issue and the vaccine not been politicized by the government intervention. In fact, I've long said if you tell people you can't have it, everybody would line up to get it, as opposed to telling them they have to have it. Dr. Barrows, we're out of time. I want to thank you again for joining us. Always appreciate your insight into these issues.
Well, my pleasure, Tony. Great to be with you again.